This is what your brain looks like now.
This is what my brain looks like now.
It's been about a year since Amanda Gamish found out she had a brain tumor.
And then I had a second surgery this January.
After 2 surgeries,
I have some clear space on this side where the tumor is gone.
she and her doctors are waiting to see if what's left of the tumor will grow.
Most patients with my diagnosis would go directly into radiation and chemotherapy, but my doctors want me to wait because they think that I have more time than most patients in my scenario.
Gamish's doctors think she has just 5 years to live. Under Florida law, that qualifies the 36-year-old to use this medical marijuana product.
I take an oil with a dropper that I put under my tongue, and I take it twice a day, and it does not affect me. It doesn't make me tired.
She doesn't take it for pain or nausea. The hope is the cannabis in the oil will shrink her tumor.
With a limited life expectancy that I'm facing, the CBD oil gives me hope for either a longer life expectancy or a possible cure to my cancer.
It took Gamish much longer than she would have liked to find a doctor who would give her the recommendation she needed to get the medical cannabis.
I knew it was legal for certain patients, so I started with a primary care physician that I had in St. Pete, and she didn't know anything about it.
Gamish eventually learned that the Florida Department of Health has a list of doctors who are certified to recommend medical cannabis on its website. But according to one of the medical marijuana dispensaries currently open in Florida, only about a third of the doctors on that list are actually accepting medical cannabis patients.
One was out of business, so I didn't get an answer, and the other one wasn't accepting new patients. My third attempt was with Dr. Rosado.
She found Dr. Joseph Rosado at Genesis Family Practice in Orange City. Rosado helped Gamish become the first patient in Central Florida to get a medical cannabis product produced in the state. It was delivered last month. When we sat down with Rosado a few weeks later, he told us he had had an influx of patients who had trouble finding a doctor to recommend medical marijuana.
I've drawn from St. Augustine, as far northeast as St. Augustine, and as far down as like Melbourne and Leesburg area.
Rosado says he sees 2 to 3 patients a day who want to establish the 90-day doctor-patient relationship required before medical cannabis can be recommended.
The types of patients that I'm getting are the chronic seizure patients or epileptic patients that are on multiple medications, anywhere between 3 and 5 medications, and their seizures are still not being controlled. The other are the terminally ill patients.
Florida law is strict about who can use medical cannabis.
Thus far, I've only had 2 patients come in that didn't meet the criteria. That's it. Everybody else meets the criteria and then some.
For Gamish, knowing terminally ill or seriously suffering patients are having trouble getting medical marijuana is frustrating and scary.
There are people who don't have 90 days.
She will live her life almost as usual, hoping to see results from the product that took her so long to get. In Volusia County, Dana J., Fox 35 News.